What's good, Hoopers? In this video, we're going to go over the injury that happened to Tyrese Haliburton from the Indiana Pacers and Gary Payton II from the Warriors, and that is a hamstring strain. My name is Dr. Gabe, Doctor of Physical Therapy, board-certified orthopedic clinical specialist, and co-founder of Basketball Doctors. Like we mentioned in the earlier part of the video, we're going to go over hamstring strains, kind of like what's the anatomy behind it, how do they get strained, what are some common signs and symptoms, how long do you expect someone to be out for when they have a hamstring strain, what are some considerations to think of when you kind of return back to sport, return back to basketball. So let's get into it now. First, we're going to go over anatomy. So the hamstring is made up of 4 muscles, 2 on the outside and 2 on the inside. 2 is kind of with quotes because the 2 on the outside is one muscle called the biceps femoris, long head and short head. And that's important because only the long head crosses the hip and knee joint, where the short head doesn't cross the knee joint. And on the inside or medial side, the 2 muscles are semimembranosus and semitendinosus. All these hamstrings work together and originate from kind of like the sit bone or ischial tuberosity. And like I said, the 3 of the 4 muscles cross the knee joint and the 1 doesn't. And what this does for the function of the hamstring is that the actions are it extends the hip and it flexes the knee. So if you want to contract the muscles fully, you're going to extend your hip and bend the leg as far back as you can, like kind of like a hamstring curl. And if you want to fully extend it, you want to bring the hip into full flexion and knee extension to stretch it out as much as you can. This is important later because when we show what happened to Tyrese Haliburton and Gary Payton, you kind of see the differences between their 2 injuries. All right, so now that we know the anatomy, how do strains happen? So typically, 1, the muscle can't quite tolerate the force that's placed upon it, and 2, the hamstring is either overstretched beyond its capacity while contracting. So a lot of times when you see these injuries, they are contracting while lengthening, or what we call an eccentric or negative. And you kind of see the 2 differences here between Halliburton and GP2's injury. We're going to go over Tyrese Haliburton injury first. When Tyrese Haliburton slips on the floor, his hip is pretty much forced into max flexion and his knee is forced into full extension. And kind of what we mentioned about with the muscle action, when it's forced into full flexion and extension, that muscle is fully stretched. And as you can see, when he gets fully stretched, you can see the immediate pain. He grabs at it. And for what it seems like with the pain, and where he's grabbing, it seems like it's more on like the proximal area, so closer towards that ischial tuberosity area. And majority of the time when strains happen, it's usually at the musculotendinous junction, so where the muscle meets a tendon and then the tendon attaches the bone. So that's where most injuries happen. Sometimes it happens in the muscle belly. It all depends on like kind of what's going on in the situation. But as you can see with Tyrese Haliburton, it's tough to watch, and based on what you saw first and what I seen first, it looked like it was going to be more severe injury. The fact that he couldn't walk, that he had to get carried off the court by his teammates, and it just looked really bad. Luckily, with the MRI findings, they just found it was a grade 1 strain. So that's really good for his prognosis, which we'll go over in a little bit. And what probably helped him is that he had really good flexibility in his hamstring. And that you can see that a lot with really like professional athletes or high-level athletes. They're strong and explosive, but a lot of times they're also very flexible. So it's really important to work on mobility, but strengthen that mobility. For example, for me, if I did that and I slipped like that, I'd probably be more of like a grade 2 or grade 3 strain, just because at my age and how I work on it, I probably don't have that flexibility just knowing myself. So luckily for him, he was warmed up, nimble, and ended up being not as bad as it looked on video. So the next injury that we're going to go over is GP2 or Gary Payton II from the Golden State Warriors. His injury was a little bit different. Kind of what we'd mentioned before, how strains happen. One of them is when the muscle can't tolerate the force that's put onto it, and 2, when it's maximally stretched while it's contracting. So as you can see, Gary Payton II here, GP2, he was playing really aggressive defense, playing really hard is what he's known for. Unfortunately, as you see, when he tries to decelerate really hard while aggressively playing defense, he's pretty much going into like an isometric contraction where his hip and knee are trying to stay in the same position, but you can tell that when you try to stay low and trying to decelerate, he goes into a little bit more hip flexion while trying to maintain his stable position, and that force that transmitted through the ground, through his leg and through his muscles, he couldn't tolerate it. As soon as that happened, you see him go down and grab at the muscle. He was kind of grabbing more towards that kind of the distal part of his hamstring at the musculotendinous junction there. And you can see as he walks, he can't quite straighten up his leg, which kind of confirms a little bit more of a more hamstring injury. And you can tell just based on where he's grabbing, it looks like it's more the inside part. So kind of that more that semitendinosus, semimembranosus muscles that we were talking about earlier, and closer to that musculotendinous junction. This one looks like it's a little bit closer towards the muscle. But again, it's hard to tell from just looking at it. Unfortunately, what we saw from reports on the MRI looked like it was a grade 2 strain, which affects his prognosis and return to sport. But again, we don't know exactly what muscle he strained. They just don't put that stuff out in the report. But unfortunately for him, it's a little bit more of a dramatic injury and of a grade 2 compared to Tyrese Haliburton, where it was more of a grade 1. And it's just unfortunate circumstances where for Gary Payton II, he's always playing really hard, coming back from that calf injury, probably favoring maybe one side a little bit more, who knows per se. But you never know how the body's compensating if he was fatigued at that point. But when he tried to really decelerate and play hard defense, that force that went through that leg, his muscle wasn't quite ready for it, went down and had that injury. That just shows the difference where walking off the court doesn't always mean a good thing. Obviously, majority of the time it means like a dislocation or a fracture isn't there, but these soft tissue injuries, you never really know how bad they can be until you get it properly looked at. So hoping for the best for both of them with their recovery. We're going to go into the prognosis of both their injuries. All right, before we go into the prognosis of Tyrese Haliburton and Gary Payton II, I want to go a little bit over how do you know if you have a hamstring strain. Obviously, we just have the examples of the injuries that happen, kind of the anatomy and function of the hamstring. So what are some of the common signs and symptoms associated with hamstring strains? In the first 24 to 48 hours, you'll notice difficulty with walking, difficulty with sitting, especially if you have more of that proximal hamstring strain, similar to Tyrese Haliburton. You're going to have point tenderness and tenderness to touch, so that's why sitting would be difficult if you have more of a proximal hamstring strain. You'll notice some swelling around the area, weakness, decreased flexibility. You'll notice some bruising that builds up over time, and those are some common signs and symptoms that you'll see kind of gradually show in the first 24 to 48 hours and progress in the first week. Especially, you'll notice more bruising after the first 48, 72 hours because swelling initially will start going away, and the discoloration from the bruising will start showing up more. You might even notice that the swelling is kind of lower down in your leg from the injury. So you might see swelling, or you might see bruising at the foot and ankle or calf. You'd be like, what happened down there? Sometimes it's just the blood pooling down the foot and ankle, especially if you're not moving around too much. But in terms of diagnosis, if you don't have access to imaging or a healthcare provider, the MRI is kind of like the gold standard for tissue injuries, but a lot of times it's not recommended unless you're at a high level, like a professional athlete, where they need to know exactly what's going on to help build a prognosis and get them back to sport as soon as possible. Or two, your healthcare provider or medical doctor is concerned about something else, whether if it's bone got pulled off or maybe a nerve damage or nerve issue, just because the nerves run very close to the hamstring. So we just want to make sure nothing else is going on that end. So that's where imaging might be recommended, where they're worried about something beyond just the hamstring or soft tissue. But to go further off of that, if you're working with a healthcare provider like a physical therapist like us or an athletic trainer, you might notice that they might do some special tests for you, like manual muscle testing, muscle flexibility. They'll start building a picture of okay, what happened? What's your clinical presentation with the signs and symptoms? So it's kind of like a diagnosis by putting a big picture together. That's usually how it happens on the clinical level. Is we don't have access to imaging or anything like that, but we can get a good clinical diagnosis based on a lot of the information that's given to us. Like we said, the history of how it happened, how you're currently presenting, these special tests of manual muscle tests, muscle flexibility, range of motion, how you're moving and such like that. So that's typically how you get diagnosed. Grade 1 strain is usually 25% or less of muscle tearing, can be just a fray of the issue. Usually not a high damage injury. Those grade 1s, for example, Tyrese Haliburton, you'll kind of expect a 3 to 6 week time frame of return to play, return to sport type of time frame. And then if it's a grade 2, where it's like a 25 to 75% muscle damage or tearing, those take a little bit longer. For example, like Gary Payton, you might see a recovery more of like a 3 to 8 week or longer is typically what you'll see. And then a grade 3 strain is when it's a complete rupture, full thickness tear of the tendon or muscle. And those can take from 8 weeks to 12 weeks or longer. And it's hard to give a true time frame because surgery can also be on the table if you have that big of a strain, because depending if the muscle belly or tendon retracted at all, and if there's no way of the muscle healing on its own, they might have to go into reattach the parts that got torn to where it needs to be so that it can heal over time. And obviously, if you have surgery, that will take you a little bit longer to return to sport. So prognosis wise, Tyrese Haliburton, I think he's pretty close to returning now, is somewhere between 3 to 6 weeks. And then Gary Payton, he's still has some time to go. He's close to 4 to 8 weeks. What we've seen with research and with people that we worked with, usually around that 8-week mark is kind of like a really good time frame of when you want someone to return to sport. We've seen by research that anything less than 8 weeks, the likelihood of re-tear for the hamstring is unfortunately higher than if you wait 8 weeks or longer. And the 8 weeks or longer, the most important thing is if you did the proper rehab, did the strengthening, regained your flexibility of the muscle and stuff like that, because you can just wait 8 weeks and that's not going to protect you from restraining it if you didn't do the proper rehab and proper flexibility work and do all the build-up to be able to return to sport. Hamstring strains or like any soft tissue injury, like these tendons, muscles, they have a high reoccurrence rate because I feel like it's skewed because a lot of times people don't do the proper rehab to get back to where they need to be and do the proper rehab of strengthening, flexibility work, plyometric training, deceleration work, jumping, all the stuff that they need to do to be able to return to sports. So that 8-week mark is kind of a good place to start if you don't have an idea of how long you should be out for. But that doesn't mean you're not doing any of like the return to sport, return to play type of stuff up to those 8 weeks. But what you'll see with Tyrese Haliburton and Gary Payton II is that they'll probably be around the 8-week time frame before they return to sport. Some things to consider as you return to sport as well is some of the tests that we'll do as healthcare providers to make sure we feel like the athlete is safe to returning to sport. And that's that manual muscle testing again, make sure it's strong and non-painful, making sure they have their hamstring flexibility back. We do that with just passive movement as well as an active range of motion test that they do. We make sure we do a lot of plyometric deceleration work. You might even see like isokinetic hamstring testing where they use a machine where you're pulling the hamstring and contracted a muscle as hard as you can as the machine moves at a steady pace, and you see how much torque and muscle output that muscle can provide. So it's something, as we do a clinical diagnosis, we put a clinical picture of how safe we feel like this athlete is returning to sport. So if you're not working with anybody, just make sure you're doing proper rehab. You can work out with us if you are in the local area of Los Angeles or Orange County. If you want to work with us online, we do take online clients. Just send us an email at info@thebasketballdoctors.com. We also have a bunch of videos on our channel that go over like hamstring strengthening rehab exercises geared towards ACL rehab, but it can be used if you had a hamstring strain injury as well. It helps really build up your hamstring the way you need to. So just to summarize, like I said, I hope you learned something valuable. You got over the overview of the hamstring anatomy, what's its function, had examples of Tyrese Haliburton, GP2, the diagnosis, how it is diagnosed, the prognosis or like time to return to sport depending on the grade of the injury, and what you should expect as you return to sport and kind of like the time frame of return to sport. So if you learned something new, please like, subscribe, comment, help us meet your hoopers, share with your family and friends. Like always, we are the Basketball Doctors. Let's ball for life.